Hello everyone and welcome to our presentation on the California Occupational Therapy Advanced Practices. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The advanced practices included here are hand therapy, physical agent modalities, topical medications, and swallowing assessment, evaluation, or intervention. So if you're a licensed occupational therapist in California, you're going to want to submit an application with the board prior to providing any of these services. And you can find all these applications on the board's website, and they're specific to either hand therapy, physical agent modalities, or swallowing assessment or intervention. Post-professional education courses must be obtained at any of the following: a college or university degree programs accredited or approved by the ACOTE, college or university degree programs accredited or approved by the Commission on Accreditation in Physical Therapy Education, colleges or universities with speech and hearing programs accredited or approved by the Council on Academic Accreditation in Audiology and Speech-Language Pathology, or any approved provider that's approved by the board. Documentation must include the following: documented proof of attendance and completion of each course, certificate of completion or transcript, evidence of the number of contact hours completed for each course for courses that are not board approved, outline or syllabus of each course for courses that are not board approved, information describing in detail the depth and breadth of the content covered, for example, a course syllabus and the goals and objectives of the course as it relates to the advanced practice area, resume or credentials of each instructor for courses that are not board approved, and verification of completion of supervised on-the-job training, clinical internships, or affiliation reflected the nature of the training and the number of hours that done. Such verification must be signed by the supervisors under the penalty of perjury. Hand therapy services may be performed only when an OT has demonstrated to the board in an application filed that he or she has met the post-professional education and training requirements. And this is completion of 45 contact hours in the subjects, including 30 hours specifically related to hand, wrist, and forearm training, completion of 480 hours of supervised on-the-job training, clinical internship or affiliation, which may be paid or voluntary pertaining to hand therapy. The training must be done in the following areas: anatomy of the upper extremity and how it is altered by pathology, histology as it relates to tissue healing and its effects of immobilization and mobilization on connective tissue, muscle, sensory, vascular, and connective tissue physiology, kinesiology of the upper extremity, such as biomechanical principles of pulleys, intrinsic and extrinsic muscle function, internal forces of muscles, and the effects of external forces, the effects of temperature and electrical currents on nerve and connective tissue, and surgical procedures of the upper extremity and their post-operative course. An OT whose application provides proof of current certification as a certified hand therapist issued by the Hand Therapy Certification Commission shall be deemed to have met the education and training requirements. An OT that provides hand therapy services using physical agent modalities must also comply with the physical agent modality requirements. It includes a maximum of 8 contact hours and 60 hours of supervised on-the-job training, clinical internship or affiliation, paid or voluntary, and this will be credited towards those requirements. Physical agent modalities may be used only when an OT has demonstrated to the board in an application that he or she has met the following post-professional education and training requirements, which includes the completion of 30 contact hours related to modalities and completion of 240 hours of supervised on-the-job training, clinical internship, or affiliation, which may be paid or voluntary, pertaining to physical agent modalities. An OT using physical agent modalities shall demonstrate to the satisfaction of the board the OT has completed education and training in the following areas: anatomy and physiology of muscle, sensory, vascular, and connective tissue in response to the application of physical agent modalities, principles of chemistry and physics related to the selected modality, physiological, neurophysiological, and electrophysiological changes that occur as a result of the application of a modality, guidelines for the preparation of the client, including education about the process and possible outcomes of treatment, safety rules and precautions related to the selected modality, methods for documenting immediate or long-term effects of treatment, and characteristics of the equipment, including safe operation, adjustment, indications of malfunction, and care. And if you currently have a certification as a hand therapist issued by the Hand Therapy Certification Commission, you should be deemed to have met the education and training requirements for physical agent modalities as well. An OT may administer a topical medication by the use of a physical agent modality only if the OT is approved by the board in the advanced practice area of physical agent modalities. The following medications are applicable and may be used by an OT: bactericidal agents, debriding agents, topical anesthetic agents, anti-inflammatory agents, antispasmodic agents, and androcorticoid steroids. Any topical medication applied or administered shall have been ordered on a specific or standing basis by a practitioner legally authorized to order or prescribe. An OT and approved by the board in the use of physical agent modalities may apply topical medications prescribed by the client's physician or surgeon, certified nurse midwife, nurse practitioner, or physician assistant. An OT shall follow written protocols in applying or administering topical medications. The protocol shall be prepared by the facility within which the topical medications are being applied or administered, be approved by the medical director or equivalent of the facility, include a description of each medication, its actions, its indications and contraindications, and the proper procedure and technique for application. Require that the administration be consistent with the manufacturer's guidelines for any equipment to be used in the administration of the topical medication, and be based on research and evidence-based practice, pharmaceutical standards of practice, and known desired outcomes. Supervision of the application or administration of topical medications by an OTA should be done under the general supervision rules. Under no circumstance may an OT or OTA administer a medication via injection. The role of an OT in instrumental evaluations is to observe structure and function of the swallowing mechanism in order to assess swallowing capability and determine swallowing interventions. The OT may not perform the physically invasive components of the instrumental evaluation. Swallowing assessment, evaluation, or intervention may be performed only when an OT has demonstrated to the board that he or she has met the post-professional education and training requirements. The education requirements includes the completion of 45 contact hours in the following subjects: anatomy, physiology, and neurophysiology of the head and neck with a focus on the structure and function of the aerodigestive tract, the effect of pathology on the structures and functions of the aerodigestive tract, including medical interventions and nutritional intake methods used with patients with swallowing problems, and interventions used to improve pharyngeal swallowing function. Training is going to include 240 hours of supervised on-the-job training, clinical internship, or affiliation, which may be paid or voluntary, pertaining to swallowing assessment, evaluation, or an intervention. An OT in the process of completing the training requirements may practice swallowing assessment, evaluation, or intervention under the supervision of an OT who has been approved under the article, or a speech pathologist with expertise in the area, or a physician or surgeon. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.